no matter what analysis you look at. I now turn to Bill Clinton. In 1993, when Hillary Care went down, everybody said, yippee, it's over. I said, stop. I said, it's not over. They're going to come back with more government-run programs. And they said, Dave, stop being the doomsayer. You know, go do more prevention stuff. And then Bill Clinton came out and said, quote, if what I tried before won't work, maybe we can do it another way. That's what we've tried to do, a step at a time, until we eventually finish this. Well, this is what they tried before. When myself and this other guy came to Washington to do this analysis for Dole, the first statement in the thing was, this creates a more streamlined, simpler system. This is Hillary Care. And we're thinking, oh, this is great, but why are there 800 more pages for us to read? And then we said, well, and we're paging through and we get, oh my God, all these federal agencies. Why don't we do a flow diagram of this Hillary Care? So we did. And eventually it was published in the Wall Street Journal. Hillary Care created 76 new federal agencies, expanded the role of 20 federal agencies, introduced 74 new federal taxes to pay for the system. Now, any system that puts patients down here and the president up here and the bureaucrats up here is bogus, because it all rolls downhill, right? The key component of this program, the heart of it, was this, the National Health Board. It was modeled after Britain's healthcare board, a rationing body. As I've tried to show you, the most unethical and inhumane means of cutting costs is rationing and denying care. It's the manipulation of healthcare need. It's unethical, it's inhumane, and it's a violation of the Hippocratic Oath. It's the exact opposite of what we need to do. Preventing healthcare need, empowering people. This went down. It was a good thing for our country it went down. Go back to Bill Clinton's statement. And this is what we got. I'm going to lay it on the line. Of the thousands of documents I've read to become a physician and work in healthcare policy, I know of no other set of documents that comprise Obamacare that strip more people of their freedom and liberty. Why do I say that? This issue has become a domestic Vietnam in our country. It's the title of a chapter in the book I gave you, The Awakening of a Surgeon. I don't use that term loosely. Thousands of Americans died in Vietnam. Thousands came back wounded physically, mentally. We paid a huge price in that war. But one of the lessons out of that war is if the policymakers and the decision makers don't listen to the grunts in the front line, you're going to lose the war. What the grunts in this country on the healthcare war, patients, nurses, therapists, and doctors are all saying is stop empowering HMOs and insurance companies and you federal bureaucrats and start empowering us, the people. Put the finances back in our hands. And instead, what they have done is they have created a domestic Vietnam with this legislation. They are not listening. They don't want to listen. I've tried. I think it's important for you to realize, and I talked about this on the Glenn Beck show. When I did his show, I had one of the websites we've listed for you to take a look at. If you go to biggovernment.com, and if you go to the contributor section and hit that tab, and a bunch of names will come down, and if you hit my name, there'll be 12 articles on healthcare reform. One-page articles, not in medicalese, all in understandable English. Lays it all out, every side of this equation. Where the problems are and what we need to do. Glenn Beck wrote something that was featured on Big Government that I had written. He called me up. He goes, I want you to be on my show. He goes, but I read what you wrote. Are you willing to say it on air? I go, yeah, of course. I say what I mean what I say. He goes, you realize when you do that, your life will be threatened. I go, yeah, it happens to me every day. It's interesting the response I get when I do Beck's show. And he was right. After I did his show, I got about 200 death threats. When I write for Big Government, when I do radio interviews around the country, when I do other TV interviews, when I present, not so much in meetings like this, but through the mass media, I do get threatened. Some threats are, we're going to end your career. Others are, we're going to blow your head off. Now, my work in prevention, as I was working in prevention years ago, as you'll see in the book, we take on multi-billion-dollar companies in some cases and show that their products are killing people, killing kids in particular, and we take them on. The first thing they would always threaten to me is they would threaten to sue me. And I go, what do? Sue me for telling the truth? Bring it. They never would. The second step was they threatened to kill me. So I figured a way how to handle that. Where it got dicey, as I point out in the book, is when they knew they weren't getting to me when they were threatening to kill me, they would threaten to kill my wife and daughters. So there were occasions where my daughters would go to school with protection, with people guarding them. When these threats started, when I started talking about Obamacare, I knew why God had put me through those other events. When I'm confronted with someone who threatens to kill me for telling the facts, what I have had happen over the years is through my friends in the Secret Service, I have a very elaborate security system for my home and for all electronic devices that I handle. So no matter how they tried to disguise themselves with their threats, I could always figure out who they were. Every single person that has threatened my life, I call them up, because they all tend to want to call me and leave voicemail messages. And I say, you threatened to kill me. My faith has taught me to give you a second chance. Here's your second chance. I want you to go to your computer, and I want you to turn it on. Because if you don't, I'm going to turn your name over to the feds, and they're going to come kick your door down tonight. So your choice. They all turn on their computer. And I say, now, you had a problem with what I said on the Beck show, or whatever the interview was. I want you to go to this page and look at it on the computer on this website, because here's the legislation that was passed. And I want you to read it to me out loud. And it never fails. They get to the portion that always incenses them, at least when I talk about it, and it's always one response. They gasp. And then what happens is amazing. Without exception, they go, I'm sorry. The very people that threatened to kill me for telling the truth, that were such zealots, all of a sudden are sorry for threatening to kill me. I said, I hope you've learned something very valuable, that before you start threatening people, you find out the facts, and you take off your biased glasses. This is not about color or religion. This is not about politics. This is about oppression versus freedom. What really bothers them, and what really got under the nerve of the administration when I talked about it on the Beck show, was Obamacare is two parts. The first part was hidden in the stimulus bill, and we found it. The way I found it was Tom Daschle, who was initially chosen by Obama to be the Secretary of Health and Human Services, is not a favorite of mine. He wrote a book. Please don't go buy it. If you want to read it, go to the library, check it out. That SOB should get 0 royalties. In his book, he talked about how the problem with Hillary care was that the Clintons were too open about how they approached health care reform, and they should have been more secretive. Imagine that. And what he said is that really what they should have done is they should have hid the rationing boards and enforcement boards in a budget bill and get that surreptitiously passed and then come in with health care reform. Friends of mine that work in the West Wing of the White House saw Daschle spending a lot of time right after Obama took over the office. And they called me and they said, Dave, something's up. Daschle is no longer the secretary designate. He had a tax problem. Right. Our Treasury Secretary had a tax problem too, but he got to be Treasury Secretary. It makes you think there might have been something else, but we'll leave that aside. He's spending a lot of time in closed doors in the West Wing. He's up to something, and I knew exactly what he was up to. He was going to hide the rationing boards and the enforcement boards in the stimulus bill. When that bill was released at 2 o'clock in the morning, that's when Nancy Pelosi released it. And remember, she had to go meet the Pope at 9 a.m. So, no, I'm not kidding you. So they had an hour to discuss it on the floor of the House to vote on it from 8 to 9 because she had to leave for the airport to see the Pope. When it was downloaded at 2 o'clock in the morning, I started reading it. And I got to page, I don't know, I was around page 600, 700, and I'm thinking, Dave, maybe you're just like, maybe you just can't stand this guy so much that, it's really not here. And then it showed up. There it was. The rationing board. In the stimulus bill, the Federal Coordinating Council for Comparative Effectiveness Research was created. And so was the Enforcement Board, the Office of the National Coordinator of Health Information Technology, hidden in the stimulus bill. Now your question, justifiably so, is, okay, come on. That's a bunch of words. How do you know that's a rationing board and that's an enforcement board? Here's how I know. Because I saw it in 1993. The British healthcare system is based on something called comparative effectiveness. They define the term. Comparative effectiveness is the approval or rejection of treatment based on the cost of treatment divided by the number of years the patient will benefit from the treatment. Rationing. It's the same damn definition they used in Hillary care. How do I know that National Coordinator's Office is an enforcement board? Because this is what it says. The National Coordinator's Office will, quote, guide medical decisions at the time and place of care. This coordinator's office will be responsible for monitoring treatments to ensure providers and hospitals are following government protocols. Gets better. Hospitals and providers that are, quote, not meaningful users of the new system will face penalties. And the Secretary of Health and Human Services, Kathleen Sebelius, oh, by the way, what was her health care? I mean, she must have been a doc, a nurse, a therapist to be the Health and Human Services. What was she? She was the governor of Kansas. And what was her job before that? Yeah, right. The chief lobbyist for the Trial Lawyers Association in Kansas. Right. The Secretary of Health and Human Services can impose, quote, more stringent measures of meaningful use over time. Okay, Congressman Thad McCotter, God love him, called me and he said, Dave, he goes, Dave, I need you to come to Washington and do what you did in '93 and lay it on the line to members of the House. I go, well, thanks, Dad, but remember the last time I did that, I had the IRS kind of living in my house for 10 years. He goes, yeah, I know, but he goes, it was kind of fun, wasn't it?